Welcome to today's exploration of post-infectious organizing pneumonia, or POP. This lung disease, while relatively uncommon, can significantly impact respiratory health. We'll delve into its causes, how it affects the lungs, how it's diagnosed, treated, and what to expect for recovery. PIOP, as the name suggests, typically arises as a complication following a lung infection. This infection could be caused by bacteria, viruses, or even fungi. Common culprits include pneumonia caused by Streptococcus pneumonia, influenza viruses, and less frequently, infections like Mycoplasma pneumonia, or even fungal infections such as Aspergillus. The infection triggers an abnormal healing response within the lungs, leading to the development of PIOP. Now, let's understand the inner workings of POP. Following the initial lung infection, the body initiates its natural healing process. However, in PIOP, this process goes awry. Instead of normal tissue repair, there's excessive inflammation and the formation of granulation tissue. This granulation tissue, composed of fibroblasts and collagen, accumulates in the small air sacs of the lungs, called alveoli, and the small airways, called bronchioles. This build-up obstructs airflow and reduces the lung's ability to efficiently transfer oxygen into the bloodstream, leading to breathing difficulties. PIOP is not a common disease, and precise epidemiological data is limited. It's important to remember that PIOP is a consequence of an infection, making it challenging to pinpoint its exact incidence independent of the underlying infection. It affects individuals of all ages and genders, but is often diagnosed a few weeks to months after a prior respiratory infection. Certain factors, such as immune system deficiencies or pre-existing lung conditions, may increase the risk of developing PIOP after an infection, but more research is needed in this area. The signs and symptoms of PIOP can vary in severity, but often include a persistent dry cough, shortness of breath, particularly during exertion, fatigue, and sometimes a low-grade fever. These symptoms may develop gradually over weeks or months after the initial infection. Some individuals may also experience chest pain or unintentional weight loss. It's important to note that these symptoms can overlap with other respiratory conditions, making accurate diagnosis crucial. Diagnosing PIOP requires a combination of clinical evaluation, imaging studies, and sometimes a lung biopsy. A chest X-ray may show patchy areas of opacity, while a high-resolution CT scan provides more detailed images of the lungs, often revealing characteristic patterns suggestive of organizing pneumonia. Pulmonary function tests can assess lung capacity and airflow. In some cases, a bronchoalveolar lavage, where fluid is washed into the lungs and then collected for analysis, or a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. While not typically categorized into strict subtypes, PIOP is generally considered a form of secondary organizing pneumonia, meaning it arises as a consequence of an identifiable underlying cause, in this case, a prior infection. Understanding the specific infectious agent that triggered the PIOP is important for guiding treatment strategies. The primary treatment for PIOP is corticosteroids, such as prednisone. These medications help to suppress the inflammation and reduce the formation of granulation tissue in the lungs. The duration of treatment varies depending on the severity of the condition and the individual's response, but typically ranges from several weeks to months. In some cases, other immunosuppressant medications may be considered. It's essential to closely monitor patients for side effects of these medications. Pulmonary rehabilitation, including breathing exercises, can also play a supportive role in improving lung function. Preventing PIOP directly is challenging, as it's a consequence of an infection. However, preventing respiratory infections in the first place is crucial. This includes practicing good hygiene, such as frequent hand washing, avoiding close contact with sick individuals, and getting vaccinated against influenza and pneumonia. Individuals with underlying health conditions should manage them effectively to reduce the risk of severe infections. The prognosis for PIOP is generally good with appropriate treatment. Most individuals experience significant improvement with corticosteroids, and the lung damage is often reversible. However, in some cases, the disease may persist or recur, requiring longer-term treatment or alternative therapies. Early diagnosis and treatment are crucial for maximizing the chances of a full recovery. Ongoing research is exploring new therapies and strategies for managing POP, aiming to improve outcomes and minimize long-term complications. Recent research involves investigations into the role of specific inflammatory pathways and potential targeted therapies that could more effectively address the underlying mechanisms of PIOP. Furthermore, there's growing interest in identifying biomarkers that could aid in early diagnosis and predict treatment response. Stay tuned as we continue to uncover more about this complex condition.